Welcome, everyone, to our latest edition of What You Need to Know. I am Jennifer Williams, your host for today. I know you may not be ready to hear these next words, so I'll try to say them quietly. But we are approaching back to school season. But don't worry, we have got you covered. I love any chance I get to sit down with our next guest because she is just that fabulous to start off, but she always has the most thoughtful information to share. Dr. Uzma Hasan is the Section Chief of Pediatric Infectious Disease at Cooperman Barnabas Medical Center, Pediatrics, a part of Children's Health at RWJBarnabas Health. And today we are going to be covering everything from vaccines to healthy eating habits, sleep schedules, and more. And we're even going to play a little round of fact versus fiction. So if you have a question for Dr. Hasan, please drop us a comment below and help me welcome Dr. Hasan. Thank you so much for being here today.
Thank you so much, Jen, for having me. It's always a pleasure.
I'm like I said in my intro, I love any chance that you and I get to sit down together. So I'm just so happy to be here with you today. So let's just jump right in. Tell us a little bit about the work you do here at CBMC.
So I actually am a pediatric infectious disease physician. I have been with Barnabas for a long time, almost hitting 15 years, and do both inpatient and outpatient medicine. We see all children hospitalized with an infection. On the outpatient side, we see a variety of infections. And then we are also, as infectious disease physicians, involved actively in infection control in the hospital setting, also in the community setting. And we also manage judicious use of antibiotics. So it's a fun role. I wouldn't exchange it for anything else.
You're one of the best to do it for sure. I know parents and patients would agree alike. So as I said, we are officially back to school in a few weeks in New Jersey. What advice do you have for parents in terms of helping them prepare their children to get back into their more regular routines? I know when summer comes, we're kind of a little lax on our sleep schedules and different things, but how do we get back into that healthy eating, sleep, scheduled routines, kind of cutting back on all that screen time?
Yeah, I think that's a very, very important question. Summer is a time where we are lax in our routines, and we want to make sure that, about a week to 2 weeks before we're heading back to school, your child is prepared. Some of the things that you've already stressed on, healthy eating, just things out there, a can of soda, 10 teaspoons of sugar. You want to eliminate all unhealthy eating habits, juices, soft drinks, and have scheduled meals. Make sure that they're getting a balanced meal. Make sure that they're getting adequate sleep. Your preschooler needs anywhere between 9 to 12 hours of sleep in a day. Your teen needs about 8 to 10. And getting them to schedule sleep routines is very challenging, but we got to make that happen. Got to monitor some screen time. So the CDC put out some real alarming data. Children between ages 6 to 18 spend anywhere up to 6 to 9 hours on the screen in forms of various gadgets, TV, laptops.
In one day?
In one day. In one day.
Oh,
and
my
the
goodness.
recommended screen time for kids less than 2 years should be none. For kids 2 to 5 years, should be anywhere up to an hour maximum, and that should be shared screen time where you're sitting together with a parent or family. And your teens should not have more than 2 hours of screen time in a day, and this is aside from homework. So we have our work cut out for us. Remember that the more time that they're spending on the screen, the more anxious they're getting. We'll see behavioral health issues. We will see obesity. Screens equals immediate gratification. So then they're impatient. They don't know how to interact socially. And this is what we are seeing in our kids. Their ability to interact with peers, to interact with adults around them is impaired. They hide in their screen. So we got to make that disappear. Some of the other, common sense things, when they're choosing a backpack, you want to make sure that they have adequate back support. They're wearing their straps both sides. Plan for homework. Don't let them procrastinate till the very end when it leads to a lot of anxiety. So if you have something due tomorrow, make sure they're focused on that. Also make sure they're not obsessive about trying to complete everything the same day. That also leads to stress. And then the other things that we always say, that the more and more we are seeing, especially in the post-COVID era, kids have anxiety about being in unfamiliar settings. So, for the younger kids, if they're headed to preschool or kindergarten, touring the school, going by the playground, familiarizing them, most schools will have an orientation, but the more familiar they are with that territory, the more easy the transition is. So these are just some common sense things to think about.
Yeah, that's really helpful information. And while we're kind of getting in back to those routines, it's also important to remember those annual checkups. So how important is it for parents to schedule those checkups for kids and to make sure all their, immunizations and things are up to date, and maybe you can tell us a little bit about, which immunizations too we should be making sure that they're scheduled for.
That's a very, very important question. So I think the one thing to remember is your pediatrician knows your child the best. And when that is your one-stop shop to focus on any issues that you've encountered through the year, any challenges that they've faced, your opportunity to raise concerns, they are going to focus on tracking their growth and development and on prevention. So they address everything at that one visit. And that is why you must have a relationship with your medical home. A lot of times when you're very worried, you need a sports physical or a physical form filled out, and people will go to urgent cares or other places to get that done. How is that different from your established care? Your primary care provider or your pediatrician knows your child very well. They will pick up on cues and that other people may not. They may be familiar with complexities in care. So, some children who are immune compromised may have additional needs, and your pediatrician will pick up on those. So very important to have that relationship. Immunizations are exceedingly important. We are seeing resurgence of some vaccine preventable illnesses. Make sure that your child in kindergarten is caught up on all their booster immunizations. So the common ones that we want to make sure that they've had is DTaP polio vaccinations. They've had their Hib pneumococcal vaccines. They've had their flu vaccines, they've had their chickenpox and their MMR boosters. And if they haven't had the most recent COVID booster within the last 6 months, that is something that you want to bring up with your pediatrician. In the adolescent age group, they've got to be up to date on their pertussis vaccine, the Tdap vaccine, which is a tetanus, diphtheria, and pertussis booster. On their meningitis vaccines, their HPV vaccines, they must get their annual influenza vaccine, and of course, the COVID vaccine if they haven't had the most recent dose.
And all of that sounds overwhelming, but don't feel overwhelmed, parents. That's why you have that relationship with your pediatrician, and kind of they can help guide you through all of those things. So we don't want you to stress either. Right?
That's very good advice. And all of this information is so readily accessible. If you go to the CDC website, if you go to the AAP website, you can readily look up which vaccines are needed. If your child is behind, your pediatrician will discuss with you on how to catch them up. So easily done.
Yeah. And I'm lucky to call Dr. Hasan my friend. So I know when she tells me that there is a lot going on in New Jersey in terms of illness and infections, right now, even just right now at the moment, what should parents be cautious of, and what signs and symptoms, and kind of maybe you can touch on some of those main ones that you're seeing a lot of that influx in.
I think the ones that I want to stress, Jen, are some of the vaccine preventable illnesses that have made a comeback. And that is because of dropping rates of immunization in the community. The big one is measles. Remember that measles is highly contagious. One person who is infected with measles will spread it to about 12 to 16 unvaccinated individuals in the room. Measles can cause overwhelming illness in the younger kids as well as the older kids, and about 50% of them will require hospitalization for measles and measles-related complications. So they can develop, ear infections or pneumonias or diarrhea or brain infections, which is known as encephalitis. The common symptoms of measles include fever. They can have a cough. They can have runny nose. They have red eyes, and they have a rash. And they are considered contagious 4 days before onset and 4 days after onset, 4 days before and 4 days after onset of the rash. The good news is that vaccination is highly effective and safe. So, the individuals who get a single dose of vaccine are 95% protected. Those who've had two doses are anywhere up to 98% protected. Measles is very, very contagious. And what we have seen in the US so far, as of August 15th, there's about 219 cases of measles in the US, reported from 27 states. New Jersey has seen 2 cases. We always rely on individuals being around us to be vaccinated. And some people will say to me, well, if the community is vaccinated, why do I need to vaccinate my child? Well, guess what? If the community vaccination rates fall below 95%, your child is no longer going to be protected by what we call herd immunity. So I can't stress this enough. You've got to make sure that your child is adequately vaccinated for measles. If you are taking up a trip to an endemic area, make sure that your child, you discuss with your pediatrician, children between ages 6 to 11 months are eligible to get a single dose of vaccine to protect them. That doesn't count towards the primary series, but it gives them the adequate level of protection. The second big one to talk about is pertussis. Believe it or not, we are seeing a 3-fold rise in pertussis or whooping cough cases within the US. And this is an illness which is caused by a bacteria known as Bordetella pertussis. It's primarily a respiratory illness. There's 3 phases to the illness. The first stage is like a common cold-like illness. And the second phase is when they have bouts of coughing, and it's known as whooping cough because you'll see them make this whooping sound, and like, that's the sound that you hear. And that phase can last for anywhere up to 6 to 10 weeks.
Wow.
In the convalescent stage, which is the last stage, that's the tail end of pertussis, that lasts for about 3 weeks. Now, the people who are severely impacted, the infants are those who cross our radar. Infants can get overwhelming illness and they don't present with typical illness, which means that they can present with episodes of gagging. They can have trouble feeding. They can stop breathing. And they can also present as sudden infant death. So we want to do everything to protect the newborn in the household. For pregnant women, they get vaccinated in the last trimester to make sure that they protect their infant with passage of antibody, so that the baby gets some level of protection. All adults in the household must be vaccinated. And this is a highly contagious illness. So almost an attack rate of about 80%. We are considered contagious with pertussis for about 3 weeks out from the onset of cough. But if you have been treated with antibiotics, that prevents you from being contagious. So New Jersey is seeing a rise in pertussis cases. Again, something to discuss with your pediatrician. Get your children caught up on pertussis immunization.
All right. What's next?
The other ones that I wanted to talk about is group A strep infections. You may have read on the news about invasive group A strep illness. Thankfully, this is rare. Group A strep is the same bacteria that causes strep throat, where children will present with fever, sore throat, swollen glands. If you look in their mouth, you may see pus in the back of their throat. They may have headache, belly pain, throwing up. Usually, kids with group A strep infections will not have a runny nose or cough. That's usually our cue. And the good news is that this is penicillin susceptible. Now, we hear a lot from parents about repeated bouts of strep that we are seeing. Usually that is happening because they're picking up a concomitant illness. Sometimes you can see failure of antibiotics because of local bacteria that are present. And sometimes that may lead to class switching, but remember that 100% of group A strep is amoxicillin or penicillin susceptible. And we want to especially stress that because a lot of times kids get labeled as penicillin allergy if they have a mild reaction. So you want to make sure that your child truly has an allergy so they get treated with the best drug. Group A strep is associated with some invasive illnesses. It can cause bloodstream infections. It can cause rarely illnesses that are known as necrotizing fasciitis or toxic shock. Thankfully, these are rare. In the post-COVID era, we did see a rise in these illnesses. So now most states have a registry where they track these illnesses. The one other piece of information that I wanted to share with all of our viewers is that not every strain of strep is associated with rheumatic fever or kidney problems, which are known as post-strep glomerulonephritis. So, as a parent, you're always worried, is my child going to get the sequelae? You got to remember that there's more than 240 types of strep. And so it's a handful of strains that do rheumatic fever, less than 1%. So you, as long as adequately treated, vast majority of children will do okay, and you don't see these rare sequelae in them. So that's strep. And then last but not the least, I wanted to talk a little bit about meningococcal illness. So you may have heard about Neisseria illness. Neisseria is a bacteria that can cause significant illness. And there's certain serotypes, which are basically types of Neisseria that circulate in the community. In the US, we see serogroup B disease. We also see A, C, and Y. And other parts of the world, we see serogroup W disease. And what we have seen in 2023 is our serogroup Y disease has gone up, and the total number of cases of serogroup Y disease in New Jersey in 2024 are so far 15. Our rates of meningococcal disease are higher than we have seen since 2014. So this is a huge rise in disease. Now, again, vaccination is protective. There are certain populations that are more vulnerable to illness, and those are individuals who don't have a spleen that functions, or they have a spleen that, they had a traumatic asplenia, which means that they lost their spleen in an accident. Kids who are extremes of age group, less than 1 year of age. The teens are more vulnerable. Individuals above 85 years of age are more vulnerable. Those in community settings. So if they are military recruits, they are in a college dorm. For some reason, they tend to be more vulnerable. And then those individuals who have certain type of immune deficiencies, HIV positives, complement deficiency. This is an important one to know, because a lot of the newer drugs that are used to manage certain autoimmune diseases, they are complement inhibitors, and these individuals are more vulnerable to meningococcal disease. How does it present? They can present with sepsis, so they can have fever, body aches, a nasty rash that progresses rapidly. They can present with arthritis, things like that. And this is a highly treatable illness, but it is also a highly contagious illness. So if I have a household contact who's had Neisseria meningitis, there is about an 800-fold higher risk for the household members to get the same illness. So you want to make sure that we are aware of this. Now, there was one particular serotype that I wanted you to know about, which is what we have seen a lot of in the US as well as in New Jersey, is serogroup Y disease. This is primarily being seen in individuals between ages 30 to 60. Individuals who are HIV positive or African American. So we have this on our radar. The other thing that we have warned is that travelers who are traveling to Saudi Arabia, there has been serogroup W disease that has been reported in these individuals. This is important to note because this may be resistant to the conventional antibiotics that we use for prevention. So if anybody has been exposed, they need to be, the health department gets involved and they track those who have been exposed and they put them on preventive medication to prevent spread in the community. So that is what we are seeing in the infectious disease world. Sorry, that was a whole lot.
That was a whole lot, but and again, we stress to everybody watching, we don't tell you this information to stress you out or to make you panic and worry that your kids are going to catch some diseases. We just want you to be aware, like, this information is important, and know that we have the team here led by Dr. Hasan that is here to help you. If you do see any of these signs or symptoms. And I think that kind of ties really important into just simple things we can do, like hand hygiene. So how important is hand hygiene?
That is crucial to the prevention and transmission of all illnesses. So remember that on a daily basis, we are picking up germs from the environment. We're picking them up from high-touch surfaces. If anybody has respiratory illness, it's through, you're picking up germs through droplet spread. If they have a diarrheal illness, you can pick up germs that way. So hand hygiene is extremely effective in reduction. In fact, there is data to suggest that about 50% of school absences can be prevented by practicing meticulous hand hygiene. And how do you know that I'm washing, you're washing your hands right? You got to be washing them for 20 seconds. Some people will sing the ABCs when they're washing them.
Happy birthday twice through.
Happy birthday, right, exactly right. And that is a reminder to us that that's the right way of washing hands. So just to remind your kids to do that, if they don't have access or are not able to wash their hands, carrying a hand sanitizer with 60% alcohol, that does the job. So you want to make sure that they're meticulously washing their hands.
And to tie kind of into just one more thing I wanted to cover with you, that mental health piece, is so important as kids do go back to school. How do we get our kids strong mentally? How do we help handle them if there's help them handle bullies if anything is happening in the school setting?
That is a very, very important question. So I think that I'm going to address the bullying part first, and then we'll tackle the mental health piece. So recognizing that your child is being bullied is extremely important. So some of the kids may not be very verbal, and you got to pick up on some cues. If you're seeing that complaints that are repetitive and happening around school timings. So, for some kids, it's abdominal pain, or I just don't feel well. I don't think I can make it to school. Some of the kids who are very socially interactive and then are suddenly becoming withdrawn. You'll see behaviors where they're suddenly getting scared easily. Things like that. And remember that bullying can be on various fronts. It can be on social media, it can be verbal, it can be happening at the playground, it can be happening on the school bus, it can be happening in the neighborhood. There's a couple of things that we need to empower our children and help them bring it forth to the attention of an adult. They should never be hesitant to feel hesitant to say that, I need help. They should be comfortable asking the adult for help, recognize that this is serious, and teach your child how to respond to the bully. So, stand up to the bully, make eye contact, say out loudly that, please don't do this, or I don't like what you're doing. Walk away in a situation that's uncomfortable. And then the other thing is that, encourage your child to share with you on a daily routine. So, every family has their own routine. Some of my colleagues will say the best conversations they'll have is on the ride back from school, where the kids are animated and they are ready to share everything and anything. Sometimes we'll do it at the dinner table. So encourage those conversations. Don't be dismissive of concerns that are brought up. Make sure that you're not on the phone at the time where they're having that conversation with you. They must feel important and they must trust and bring that forth. Yeah. The mental health aspect of things, more and more, we have seen a rise in mental health issues, anxiety, depression, things like that. Again, the limiting screen time, allowing for social interactions, giving your child the opportunity to share, making sure they have friends and they feel supported in the school environment and otherwise. Those are all important things to make sure that they're successful and they feel protected.
Yeah, it's so important. Okay, so we have a little bit of time left. So a little rapid fire game of fact or fiction, kids edition with you. I have a few different categories, so we'll tackle them each through and just whatever you think. First response, fact or fiction. Okay, fact or fiction on vaccines. Vaccines are not safe.
Fiction. Vaccines are absolutely safe. We have a huge amount of data to support that the safety of vaccinations, and a huge amount of data to support that you can get more than one vaccine at a time. This is being proven in the vaccine efficacy trials that are there. Co-administration of vaccines is safe and it protects your child.
Okay, kids are naturally protected and will not get serious illness if not vaccinated.
Fiction. So we have seen time and again that children can get overwhelming illness. Multiple examples to show that and children with chickenpox can get overwhelming illness, wind up hospitalized with pneumonias, with encephalitis or brain involvement, overwhelming complications. Children with COVID, we saw that 100% of the children who were hospitalized were unvaccinated children. Children are not naturally protected from exposure. They can get overwhelming illness from vaccine preventable diseases, and we need to be mindful of that.
Okay, next section, fever. The higher the fever, the higher risk for seizures.
So this is a good one. So couple things to know. The children who have a tendency towards febrile seizures may often have a family history. And anything above 100.4 is considered a fever, and they have a risk for seizures. Some people will say above 101, the risk of seizure may be higher, but there's a couple things that we know. Medicating them with Tylenol, Motrin does not eliminate seizure risk, but it does provide some comfort. So the advice that we give to parents is that make sure that you're actively cooling them, make sure that you're keeping them comfortable. Children between 6 months to 5 years is where you have the risk for febrile seizures for the most part. And the kids who have, seized at a lower temperature have a higher risk of recurrence, especially if there is a family history of febrile seizures. So seizures can be scary, but remember that these do not correlate with long-term brain damage, the febrile seizures, and their developmental outcomes are completely normal.
Okay, moving on to infections and illness. People are contagious for weeks after being ill.
Depends on the illness. So the rule of thumb for viral illnesses for us is that if they are fever-free for 24 hours and symptoms improved and they can participate in normal activity, they are good to go back to school. That's the rule that we follow.
Mm-hmm.
And there are certain illnesses, in particular, as we talked about, things like pertussis, where if they're not treated, they can be contagious for up to 3 weeks out from the initial onset of cough. So depends on the illness.
Okay. And last one, children can't get seriously sick.
That's a myth. We have seen that children can get overwhelming illness, and we want to make sure that we equip them well with the necessary prevention measures, make sure that they are adequately immunized, and make sure they are able to interact into their normal environment. So yes, they can get seriously sick, but if we protect them with what we have available to us, they're going to have a great school year.
Yeah. And what a way to end our live today. Thank you so much for being here. We've shared so much information with you all out there today. So please, if you have any questions, you can leave us a comment below. Dr. Hasan is really great, and we'll get those messages to her. And you can always visit our website. So for more information about our children's health services, please visit rwjbh.org/children's health. And Dr. Hasan, so good to see you. I haven't seen you in the hallway a while, so I can't wait to see you again in the hospital. But I hope that that was very helpful for everyone today. And thank you again for taking the time to be here.
My pleasure. Thank you so much.
We'll see you next time, everyone. Take care.
Take care. Bye-bye.
Bye.